The Trump administration is proposing a new set of rules that would make it more difficult for immigrants to maintain their legal status. The changes would deny green cards or visas to more immigrants using different kinds of government assistance. The changes also target any immigrants with a household income below $62,000 a year for a family of four. Among the groups trying to rally opposition to the changes is the Mass Immigrant and Refugee Advocacy, or MIRA coalition. We'd like to welcome its organizing director, Liza Ryan. Thank you very much for being with us, Liza.
Thanks for having me, Chris.
First of all, talk about the standard here and the kinds of government assistance that this proposal involves.
Well, fortunately, you may have heard, or I know that we on this show talked a little bit several months ago around a leaked draft before that had START and many other like CHIP and other benefits that were on there. Now the federal administration has decided that it wouldn't necessarily attack those benefits that were particular to children, but it will include on this one Section 8 housing, non-emergency Medicaid, as well as SNAP, and it will also include the previous benefits that fell under the public charge definition, which were TANF and SSI, which were cash benefits, and very few people receive those.
And if some immigrant starts using those programs while they're here, even if they came here legally at first, what does that mean?
Well, it would only apply to lawful immigrants. So first and foremost, we are talking only about people who are here lawfully, and among those, there are very few that actually have access to benefits because we have narrowed that scope also very limited. That's also very limited. So the persons that would have those services right now, and one thing that is important to remember, Chris, it's less so much about the services, and it's more about being working class. It is, as you mentioned before, this is about if your family has an income of less than $63,000 for four people, which 45% of residents of Massachusetts would fall under that designation, the federal government could label you a public charge. And to give some reference to what that term means, we've been using it since 1999 to determine a person who was likely to be subsistent on the federal government for their livelihood, meaning that they could not in any way support themselves. So that was with cash assistance. It was a very limited scope. But now we are expanding that, not just based on those benefits, but really on working class families.
Well, I mean, I can't help but imagine what the Trump administration is appealing to here is the sense that, we're not going to put up with these freeloaders anymore. To what extent are we talking about freeloaders?
We're not. We're talking about families that at times need a little bit of help, like many American families. And remember, these immigrants, these families are paying taxes. So they have a right to receive these benefits themselves. And so what we are doing is saying that we really, in this country, we only want the healthy, the wealthy, and the white. Because also as a part of this potential rule change, and I just want to be very, very clear, this is just a proposal. It is right now on the federal, so on regulations.gov, you can look at it, and there is an open comment period in which many organizations across the state, including our state agencies, are commenting and saying this is going to be terrible for our Commonwealth. We have until December 10th to file those comments, and they need to respond to them. So this is not active yet, it's just proposed. But the other limitations, so for example, other groups of people that we are looking to limit their green card access. People who are under 18, people who are over 65, who have any type of medical disability and do not have their own private insurance, people who are not proficient in English. Again, when you look at the only element that is a positive element in your application is if you are over 250% of the federal poverty line. What we are saying is we only want healthy, wealthy, white people in this country.
This has been the news, and we're talking with Liza Ryan from the MIRA coalition. Liza, I'm imagining there are a lot of mixed cases within a household here.
Absolutely.
You might have a couple of people who are, with full-time jobs, they make plenty of money, they pay taxes, and maybe their mom back in the old country gets really sick, and she becomes sort of a public charge. I mean, how do you navigate that?
It's extremely difficult, and I think that's one of the problems, Chris, is that even for us advocates, even for people who are whether they are part of a food bank or they work at Lynn Community Health Center, they are experienced with dealing people with their eligibility for benefits. This proposed rule is extremely complicated. You're talking about immigration and healthcare and benefit eligibility, two very complicated issues. And what is happening in that process is that many of the details are being lost. So many people who this rule would not apply to. And to be clear, there are many groups of people that this would not apply to. If you already have your green card, this would not apply to you. So if you're applying for citizenship, this would not apply to you. If you are a refugee or an asylee, this would not potentially apply to you. But at the same time, that's getting lost because this is an outcropping of the rhetoric that the administration started its campaign with, and that is to create fear and misinformation. So people who are in mixed status families who, again, may have a credible right to apply for those benefits for that limited time that they need to take care of their family so they can be contributing members of our society, they are being concerned that they would have to choose between taking care of grandma or getting the little bit of help that they need for their children to feed them, to give them the sustenance that they need to be able to learn at school, or being able to bring their husband so that their family can be reunified. This is the system that our country was built. This is the system that Boston was built on. We believe on being able to have immigrants come into our country, to working together, and that they lift themselves up, and while they lift themselves up, they lift the rest of our country up. What this is doing is cutting out those first couple rungs of the ladder.
I know you mentioned, as things are right now, immigrants in many cases are ineligible for benefits, so they're not receiving them for given points in time. But there must be numbers out there about the odds of immigrants being on the dole as opposed to the rest of us. What do we know about that?
It's very limited, right? This has, even as we saw the fight over affordable care, many immigration and immigrants were often on the chopping block. When we talk about extending Medicaid or extending Medicare, we often leave out lawful immigrants in that. So there are very few lawful immigrants and no undocumented immigrants that are on those types of services. So in reality, this is not actually targeted towards numerically a very large group of people, but it's made to create fear. So what will happen, and what we're already seeing across the Commonwealth, is people are coming in and saying, I know that I'm receiving these types of health benefits, I have every right to do so, but I am afraid that this is going to hurt my potential eligibility for a green card, and having a green card is imperative for my family and being able to provide for my family in the future. And so I'm going to forego the medical treatment that I need, that I have been paying taxes to receive in order to reunify my family.
I have another question. If these changes were to take effect,
Yeah.
Some people might go back where they came from, some people wouldn't come here in the first place. But what about the people who are still here? I mean, what would happen to them, and what does that mean for the rest of us?
Well, I can tell you it would be terrible for our state, right? So we would have many people who would disenroll from things like Medicaid. And so where would they end up? In our urgent care, in our emergency services, the most expensive type of health care. And so that would cost our state more. When children do not have access to SNAP, when they don't have access to food assistance and nutrition, then they can't learn well, which means that they're not going to be able to do well in school and contribute to our society. So what we will see is we will see some of our community health centers be impacted financially dramatically. They would potentially need to lay off staff. We've already had conversations with some of our community health centers and some of our safety net hospitals, and they would be also financially hit. So from a financial perspective for our state, this would be terrible. And what it would do is we're explicitly saying that we want a second-class citizenry, that these people are not worth the investment to help them integrate, to become the kinds of Americans that we all want to be, ones that are proud, that can support our own families.
Thank you very much for being with us.
Thank you.
Liza Ryan from the Immigrant Coalition.